Hi, this is Shelley Kraft, and welcome to SNNLive. We're at the Southeastern Medical Device Association 2013 conference. We're at the Georgia Tech Global Learning Center in Atlanta, Georgia. I have with me Peggy Sammon of GeneCapture. That's G-E-N-E. Capture. It's a private company. Peggy, welcome to SNNLive.
Thank you, Shelley. Appreciate you talking to me.
It's good to have you. Okay. GeneCapture.
GeneCapture. We are in the business of identifying gene signatures very quickly. And right now we're developing a product for very rapid infection detection. So the current method for doing infection detection takes 1, 2, or 3 days. And we have come up with a method whereby identifying the signature of the pathogenic gene, we can do it in about 1 hour at a very low cost and in a portable machine. So that's what we're building. We're an early stage company. We're pre-revenue. We have patents already awarded on our system, and we're glad to be here to interchange with other people in the SEMDA market.
What's your background?
My background is business. I've been an entrepreneur my whole business career. I like growing, starting, and selling companies. And I got attracted to the GeneCapture opportunity because it's a very novel technology that provides a solution to a huge problem. So it's not a niche. I liked going into something big.
I like it too, by the way. So who's the science? Who created the science?
There's 4 engineers on our patent, 4 co-founders, chemical engineers, biologists, and scientists. And this technology would not have been possible if not for some of the advances in the gene sequencing and genome fields today. But because of those advances, we're now taking opportunities that didn't exist before to take that technology and put it right into a commercial application.
This is cool. Now, we have, I like your way of putting it, detection and all. When do you think this device, I know it's dependent upon financing, no question, but how this might not take too long to get to market?
Well, we are developing an integrated prototype now, which we hope to have by the summertime, so we'll be able to prove that this works in an integrated machine. Right now we've proven over 400 times that it works in the lab. But once in the machine, there are several applications that do not require FDA certification, like food safety, border patrol, FBI has some applications. So we'll pursue some of those to build a revenue stream while we're developing our FDA strategy.
In terms of rape kit, is that's not what you're talking about. You're talking about other kinds of detection, correct?
Correct. We're talking about actually identifying the pathogen in a sample. So it could be a blood sample, but the primary application would be a patient arrives presenting with symptoms for an infection, and the doctor says, I don't know what it is. Maybe it's staph, maybe it's strep, maybe it's TB. We run a sample over our slide, and we can identify which pathogen is in that sample.
I see this developing into something that might occur in a much larger market as well, like the employees in a hospital. And, you know, because staff in hospitals is a major problem. Am I correct?
You are correct, and there is an application for surveillance of facilities, surveillance of employees. That is a big application. We're focused on infection detection because the healthcare market needs this technology so badly, but you are right, Shelley, there's a lot of other applications, and we're excited about them, but we don't want to be distracted.
You can't be, because I know if I'm thinking I got more coming, you know, and I'm saying to myself, you know what, you as a small company has to stay focused, and you have to get into revenue as fast as you can so that the investor audience that comes and participates in financing you sees some return on investment. I'm sure you're aware.
I am aware of that, and we've got a very fast model, but I think we can build our reputation on non-FDA certified products and then move into the FDA certified stream.
What is your website?
www.genecapture.com. We are one of the 22 selected companies at the Hudson Alpha Institute for Biotechnology in Huntsville, Alabama. It's a wonderful facility there, which is incubation-like for biotechnology companies.
So Huntsville. Okay, tell me a little bit more about that area, because I know it's a pretty big federal funded area.
Yes, it is. Huntsville is known for instrumentation, for defense, for aeronautics, but it is becoming known for biotechnology because the Hudson Alpha Institute for Biotechnology is now one of the top genome sequencing centers in the world.
Wow. Okay, let's give the website one more time.
www.GeneCapture.com.
Ladies and gentlemen, this is Peggy Sammon of GeneCapture. It's a private company. I'm Shelley Kraft. This is SNNLive. We're at the Southeastern Medical Device Association 2013 conference right here at the Georgia Tech Global Learning Center in Atlanta, Georgia. I want to thank you so much for coming on.
Thank you, Shelley. Appreciate it.